Good evening, everybody. You're very welcome to the University of Warwick Medical Education MSc, PG Dip and PG Cert information briefing. We're so welcome and we're so happy to have you here this evening. Just a running order for this evening is that the Head of Academic Affairs, Mr. Diarmuid Brannock, will be having a fireside chat. Unfortunately, they're not beside a fire and they're not beside each other in this new Zoom world, but they will be chatting about medical education, about our programme, about, I suppose, the progress that's been made in terms of the pedagogy around medical education and how exciting this new programme that we're launching is, and how we really are breaking boundaries, I believe, in what we've achieved and what we will achieve in the rollout of this programme. So they'll be giving you an overall sense of what it's about. And after that, we will have a presentation, a deck, from Mr. Diarmuid Brannock, and that will be all about the curriculum, the pricing, accreditation, recognition, everything you need to know about the granularity of the programme. So without further ado, I will hand you over to Diarmuid and Val.
Thanks a million, Rebecca. So yeah, by way of introduction, my name is Diarmuid Brannock. I lead the academic team here at IHED, and effectively I manage the relationship with the University of Warwick and with all the faculty in the programme. Delighted to be joined by Professor Val Was. Val, do you want to outline a bit about your background and role in the programme? And
I'd be delighted to, and it's lovely to see so many people here. And in fact, it's because we're developing something which is fun and exciting, international and interprofessional, but interactive online, that I agreed with Diarmuid that I would become online as a program lead for this program. What do I bring? Well, I'm a clinician. I've worked in secondary care and then predominantly in primary care, but over the years, I've increasingly done medical education. My master's, in fact, was in Holland, in the Netherlands, and it was multi-professional and multicultural as well. And I built from there a PhD with an interest mainly in assessment around that one. And over the years, I've worked in 4 medical schools, ending my career as head of one of the new medical schools in the UK. But I've worked a lot internationally, probably now at the last count in over 35 countries. So this is an ideal opportunity as I approach the end of my career to be supporting this sort of development when we can bring you together to learn from each other. We've got so much to learn from whatever country we come from, but we want it to be fun and interactive and practical, not steeped in theory and in isolation. So it's a great opportunity to be launching this, and hope you'll want to join us.
Thanks so much, Val. And you know, you've had a long career in medical education and in the helping various institutions and indeed countries' health systems professionalize the education and training environment that they have. Why do you think there is this move to further professionalize the standing of medical education within a health system and make sure that people that are teaching, that have supervisory or teaching or mentoring roles within the health system, actually have a formal qualification underpinning it?
Because increasingly, I think there's a realization. There used to be a sort of belief, if you can't do research, then you teach, as though it was sort of second rate. I think we realize now, and universities and postgraduate training programs recognize that that's not true. You do really have to teach with a theoretical background, and that's coming out in that much more on university promotions, or even also in deanery or postgraduate training. Promotion often depends on whether you've got a degree of some sort, at least a postgraduate certificate. But I would say from my own experience, to actually do a master's and learn how to evaluate what you teach and research what you teach just really enriches what you have to offer your students. We need to base education on evidence, not on anecdote. And this is generally much more realized, fortunately. So you can either do research or you can teach. They should have equal merit and therefore equal thing. And I did my PhD in my 40s. So it's never too late in teaching it's easier in teaching to do your academic progression later on than earlier on than it is in research.
Well,
Does that make sense, Dermot? I hope
no,
makes sense.
it absolutely does. And I think, you know, the evidence base that you speak of, you know, is vital. And in every other area of medicine, you know, we look to what the evidence base says. And similarly, you know, within teaching and education and the psychology of how people learn, you know, there are building blocks there that we should be basing what we do on solid science. And I suppose, Val, in the design of this course, and we've taken a long time to arrive at this program. It was very important in that process to link the theory to practice. And as you say, you know, the program has to be practical and fun. What ways do you see that we kind of bring the education theory to life within the program?
Well, there's so much evidence now that what we remember what we're taught if we learn it in context. I mean, a lot of us who learned medicine the first 2 years theory and then go to do the practical, you forget the theory, and you only really embed your learning if you do it in practice. So what I've learned over the years, it's much better to have some theory, and we'll be delivering that online at a very high standard as I watch it develop. And the people delivering the theory will also be thinking through how you practically embed it. So we might teach you about how to do assessment, but then also ask you to do an exercise. And we plan also, what I've learned over the years, it's you learn so much when you work internationally from each other. People in low resource settings have some amazing ways of teaching and solving low resources. So I learn as much when I work internationally as probably the people I'm working with do. So we will want to try and mix people internationally, and there might be groups of 4 who are working on these practical projects to embed the theory, and then we'll bring it back to a bigger group of 20. So it's contextualized learning. There's so much evidence now that you remember things if they're in the context of what you're doing.
Yeah, and I think, you know, you've answered there one of the other things that I was going to raise, which was the very international nature of the program. And, you know, this program is going to have people from the UK, from Ireland, other parts of Europe, from clearly judging by the audience this evening and on the last webinar that we did, from across the Middle East region. And we have people joining from places like Malaysia, Singapore, and Australia. And, you know, they are all going to bring different education backgrounds, different standards of how that is applied in healthcare, different scopes of practice, and different resource contexts. So, you know, that is going to make for absolutely fascinating learning from each other. And, you know, I think the international piece is going to be huge. But how important do you think interprofessional education is as well? Because, you know, even on the call tonight, we've a huge variety of professions on the call.
I think it's absolutely key because future healthcare will be team-based. I mean, WHO are addressing a problem where we're short of 18 million healthcare workers across the globe, and you're not going to have doctors doing all those roles. We're going to have to much more interprofessional working, sharing tasks, and dispelling the power and the hierarchy that we've worked in for so long. So it's really important that we learn how to work together, but also how to train our future doctors so that they can work together in different structures. It's been difficult to launch interprofessional learning. We've been trying certainly at undergraduate level for many years, but I think it works best again when you do it within the context of healthcare. So here we would be doing it in the context of teaching and working together. And of course, we're riding on the wind of opportunity at the moment because of COVID, because that's really shown us that we can work on Zoom across different cultures. I mean, I can now link on I'm chair of the Wonka Working Party on Education, and we can meet, and Australia's a bit difficult, but we can meet from Asia across to Ecuador and Canada in one slot together to discuss what we're going to do. And that's what we aim to do.
And
we've had debates about that, Dermot, haven't we? But we will try and link you across time zones.
I think it's going to be fascinating, Val, to see. You know, we get the most spirited debate and discussion when we don't have homogenous groups, when we have different perspectives, and I think that's going to be a real strength of the program. The other piece that I think is going to be extraordinarily important in a program like this is, you know, there's an importance in medical education or health professions education in how this is applied, and to do that it'll require an element of, you know, self-assessment and personal reflection. How important do you think that is in the program, and how are we going to give feedback to people to make them more effective educators?
Well, I suspect many people already have reflective skills, because we need that for clinical practice. I mean, when you make a mistake, we all have to look at it and think, why did it happen? Or what would you do differently next time? Or if we do something well, why did it go so well? And how can I build on that in future? So we are building on skills that are within us all already. I think that you do have to reflect on what you're learning. What have I learned today? How's that going to help me when this is when I teach next time? Yeah. This is what opened my eyes when I went to Maastricht, that suddenly I was learning theory and I could think, oh, that's why that works. Perhaps I can do it a bit differently next time and make it even better. There's a lot of debate where you always have to write long written reflections. So we shall make it interactive reflection as well. A lot of people say I reflect in my head rather than on paper. And I do bear that in mind as an educator at the moment. I think evidence is really emerging on that.
No, absolutely. And I suppose, Val, in terms of, you know, clearly there's a huge level of interest in this area, but actually in terms of impact on career and career development, what have you seen personally from your own perspective? But then what do you think is the kind of the career opportunities or impact from people from doing a program like this?
Well, I think, as I've already said, that if you want to build your career as a teacher, then another qualification is important now to many people in university for promotion. It's also getting competitive. At Keele, where I was head of the medical school, we had medical students doing a master's in medical education. And there's certainly one of them at the moment of that group is now doing a PhD as he does his GP training in medical education. So it's becoming the norm, I think. And certainly my experience internationally has been that people can get promotion once they've got the extra qualification within the context of postgraduate training or wherever they're working. So I think it's a good currency to have.
Yeah.
But I also think it makes you a better teacher and educator. So.
Yeah, I completely agree. I think, you know, there are very personal reasons to do a program like this, which is your own effectiveness and, you know, the people, be you mentoring, supervising, training, teaching, etc., that you will be able to better engage with as a result of your own development. But then, you know, that cachet of having it on your CV and having the benefit of it on your CV, I think is, you know, if there's two people standing beside each other and one of them has a qualification in medical education and the other doesn't, you know, there's an obvious advantage conferred on the person that has it. I think I'm conscious of time. Val and I could chat like this all evening. What I'm going to do, I'm going to share screen and go through, because I see a lot of questions coming in on the chat.
Just before you start, can I just run that poll, Dermot, if you don't mind?
Yeah, of course.
Great, everybody, I'm just going to run a quick poll. It will only take a few seconds, hopefully. We've had wonderful participation on our polls and our webinars today, so hopefully you can compete with your fellow clinicians from former polls. I'm just going to launch it now. If you don't mind, I'll have one now and one at the real end of the session. So we're getting on average around a 70% response rate to the polls, which is great. So thank you so much. It's really just important for us to understand your motivation for being here this evening, so we can correctly just nuance our communications after the event to you. We're always very interested to see, in terms of the qualifications, are you interested in the certificate, the diploma, and the MSc? So it's always very interesting to see exactly which what qualification most appeals to you.
Yeah, and we definitely need music for this for the next time. We keep
We
saying
do. We need elevator music, definitely.
Or dramatic music.
Or you can play the guitar, dear.
So yeah, there's about 66% have voted so far.
See if we can push it above 70, and then I'll
yeah, and interesting, the Masters is coming out by far tonight, which is great.
We've seen that repeatedly as the #1, but it's quite considerable #1 today, which is wonderful to see.
Yeah, and I think to Val's point, and we'll go through the kind of the objectives and the learning outcomes of each stage, but the Masters really is the point where you do a professional project and you go into huge depth in something, and you get the experience of doing a piece of work, critiquing it, and it's a different level entirely. So okay, we're at 74%, 75% voted.
Yeah, that's wonderful. Thank you very much.
That is fantastic. Right, I am going to share screen here, and hopefully everyone can see my screen now. Yeah, that's up, Rebecca, yeah?
Yes.
Yeah, brilliant. Okay, so the first thing, there are many people on the call from across the Middle East, and you will have seen IHED and you'll have seen the University of Warwick used interchangeably in relation to this program, and will continue to do so as we go through. So effectively, we are an Irish medical education organisation. We have a huge depth of experience in the Middle East and across Asia as well. Effectively, we were founded by a family doctor in 2013 who really has a mission of bringing very high quality medical and clinical education to people around the world at an affordable price point. He looked at the opportunities that clinicians had to study, and there's a huge range of quality and of kind of affordability there, and we came up with a model which allows us to bring qualifications from the likes of Warwick or the Royal College of Physicians to a very broad audience, which is fantastic. We've done an awful lot of work in the Middle East with health ministries in UAE, in Qatar, in Saudi. So the new family medicine academies in Saudi, we set those up with the Saudi Commission. Anyone who is from Qatar who has done any of the online content from HITC, that has been IHED content. Similarly, we work with the Ministry of Health on the Workforce Strategy Development Committee in Qatar as well. So we've a really rich set of relationships across the Gulf, and similarly we've new residency programs in UAE now as well. All told, we've over 400,000 course completions on our platform today. So online medical education is kind of what's in our DNA. It's all that we do, and we think we do it extraordinarily well. The University of Warwick probably doesn't need an introduction. They are ranked 8th in the UK. They are 62nd in the world. So they're an absolute elite institution. In the UK, they're a member of the Russell Group of universities, which is the leading research-orientated universities in the United Kingdom. They have been running their on-campus medical education program for over 20 years now, and it's extraordinarily well regarded in the UK. And they're one of the top universities out there. This program is a very different offering, obviously, than an on-campus program. And what you'll see as we go through this presentation is, this program has been designed to be online from the outset. It's not a campus-based program that, because of COVID, has been flipped to an online offering. Every piece of it has been designed to be wholly online from the outset, and that changes the approach that we take to certain things. What is important is it's accredited by Warwick as a level 7 UK qualification on the UK National Education Framework. So that is the exact same standing as any of their other programs. So the fact that you're doing this program online, be you in the UK or be you in Europe or the Middle East or Asia, it has absolutely no difference to the qualification that you get. It is a University of Warwick postgraduate certificate, diploma, or master's program. The certification does not mention online, does not mention distance, does not mention IHEED. It is simply a University of Warwick award, the same as any other. So to go through what the actual program looks like, the program is delivered across 3 semesters. So semester 1 is the postgraduate certificate. And we start off with really essentials of medical education. So we ease ourselves in with an introduction to learning theory, to curriculum design and professional values, and assessment for learning. And that's going to be a key thing that you'll hear Val talk about later, is the difference between assessment of learning and assessment for learning. Assessment can be used to check what skills or knowledge somebody has or competence they have, but it can also be used as a learning tool in its own right. There's a huge range of professions on this call, and a team-based approach to education is vital. In a similar way that the medical model of doctor instructs downwards is very much going out of fashion. Similarly, education needs that team-based approach. The second module on effective teaching, this really is all about kind of personal growth and development. So you do a self-evaluation of yourself as a teacher. You look at how you teach within different learning environments, and then learning to plan and design curricula with colleagues. It's a very reflective piece, but also giving you a very practical set of skills and tools to use the next time you go to design a piece of education. Assessment is exactly what it says in the tin. It builds on from module 1 in terms of the assessment for feedback and learning here. We look at giving feedback. We look at choosing the right assessment. So you've got a curriculum with a set of learning outcomes. What's the most appropriate assessment strategy? What assessment will you have that's formative, that will be used as a learning tool? And then how do you assess competence and capability in a clinical setting as opposed to an academic setting, and things like blueprinting and standard setting. So the postgraduate certificate really gives you that kind of base framework in medical education, and it gives you an overview of planning, curricula, delivery, and assessment. So we then move on to semester 2, which is the following 6 months, and this is the postgraduate diploma. So again, we're spiraling the learning all the time. So we take what we've done in semester 1 and we then look at learning technologies, and that is looking at everything around choosing the right types of technologies, creating content, looking at social networking, collaborative learning, and some of the broader issues around ethics and consent to do with using learning technologies in medical education. And what we'll be doing in this module is going to be taking what you will have created in modules 1, 2, and 3, and very much seeing then, well, how do we use technology to enhance this? And I think there's never been a better year to be more confident using learning technologies and to know how the impact of COVID and what it's done to online and blended learning education is it's just been phenomenal in terms of the acceptance of what technology can do. Module 5 then is all about management and leadership, and people that are doing qualifications in medical education, as Val has said, they very much want to progress in their career, and a key part of that is to understand your leadership traits, to understand how organizations work, to understand how change management works and how resistance to change can manifest itself, and team dynamics, which can work brilliantly or spoil entire projects. So management and leadership is a critical part of personal growth and development, so it's an important module to have in. And then the final module in the diploma is very much looking at it's setting you up for the masters. So it's going very deep into critical appraisal of literature, of being able to formulate an idea and an appropriate research question, and then being able to design how that question would be answered in terms of methodology, data, etc. So it's really, it's giving you that research methods base in advance of doing the MSc. Val, before I move on to the masters, is there anything you want to add in terms of the program content across the certificate or the diploma?
I think the most important thing we're finding in designing it is that we use what we call a spiral curriculum, so that we're always building learning. So when we start with certain concepts in module 1, we're working very hard to make sure that we then revisit them in module 2. So the whole time you're sort of reinforcing your learning. A lot of it is new language if you're used to working clinically. So we're trying to build it so it's easy to remember, and so it's always getting more complex as you move into the diploma towards doing a master's, and also engaging you and exciting you so that you want to go on and learn more and do the diploma and master's. So there's a lot of thought going into constructing these modules as to how we build your learning constructively and make it fun at the same time. Does that make sense, Dermot?
Yeah, no, absolutely. And I think we'll come on to the assessment in a couple of minutes, because I think that's something that, to your point earlier, Val, people need to be able to see, well, how will I use this content that I'm learning next week? How will I be able to put this into practice? So the masters then, following on from the diploma, then we move into the masters. And sorry, what I should have said was, within the diploma, each of these modules are 6 weeks long, and each of the white boxes here represents a week of content. So, for when we start in at the end of June, week 1 we'll be looking at learning theory, week 2 we'll be looking at curriculum design, etc. When we come to the masters then it's a 10-month long master's program. So we start off with really refining our research question and looking at the design, the methodology, the data collection that we're going to use to carry out our professional project. And then you're paired up after those initial 8 weeks of kind of the thought piece. You're then paired up with your supervisor, and your supervisor will have an interest in the topic area and methodology that you're carrying out for your project. And what I think is particularly innovative of Warwick, the output of that isn't a dissertation. It's a 4,000-word journal article, and it's a conference poster presentation. So we want people coming off the program to have a very tangible output for their efforts. PhD by publication and research by publication is becoming the norm, and I think it's a far more contextually relevant output for a master's program for you. And we want to see people published. We want to see people taking their work and getting recognition for the hard work that they've done. So that's how the master's program ties in. So semester 1 is approximately 6 months to do the certificate, the same with the diploma, and then 10 months for the master's. So, it's a very well-paced and well-structured program. I suppose on a personal level then, kind of how does this work, and really what does it mean for me? So we'll start off with a very good induction program, and then thereafter, and that will get you used to the online platform, the group that you're with, meeting your tutors, and all of that. So we start off with a very solid understanding of what the program is going to be like. Each week then will follow a pattern. We'll start the week off with a tutorial, and that tutorial will contextualize the content that you're going to go through during the week. It will set whatever activities you have to do, and really, discuss how you will put this content for the week into practice. The online content you go through at your own pace during the week, and I've taken some screenshots of what it looks like. It is very, very practical, applied content. We put a lot of effort into the design and the user experience. It's all high fidelity content. It's very interactive. There's lots of kind of quizzes throughout. There's lots of feedback points throughout. There's lots of reflections throughout it, and lots of video throughout it. So you go through that content at your own pace during the week. So if you're studying the week on curriculum design, we come together at the start of the week and we have a discussion around what the theory says about curriculum design, then how will we put this into practice, and then you go through that content on the platform in your own time and carry out whatever small piece of work there is to do, and then that forms the start of the tutorial at the next week, where you reflect on what you've done the week before and then start into the next topic. So this cycle is a really nice rhythm to keep you engaged with your colleagues and with your tutor. And hopefully what you're getting a sense of is that while this program may be online, it's not distant in nature, that you're going to be very close to your colleagues in the program, you're going to be very close to your tutor and to the course management team. And the assessments on the program are very practical. And as Val said, the reflections are, having an evidence-based reflection is an important part of really looking at, well, how am I going to apply this? So in terms of what the program actually assesses then.
Could I just interject there, Dermot?
Of course you could.
If you go back to the structure, are you able to go back?
Yeah.
Or not? It's just that Marie Andrades, who's doing the module 1 for us, she and I were going through some of the online material. It's great fun because you get lots of little quizzes as you go, which we were doing, and then just cheering when we got it right and in despair when we got it wrong. But it's something you can do when you're tired at the end of the day and just build your learning. There'll always be some reading, but most of it is supplementary reading if you're really interested in a project. But you will be required to make reflective notes and then discuss them on a discussion board or discuss them with your small group of buddies. You'll be in a small group of 4 or 5, in which case we might ask you to do an offline task. But it's very, very practical, and it's designed that you just pick the theory up as you go rather than have to do a whole load of sitting there reading. That's right, Dermot, isn't it?
That's, yeah, and it's such a valid point, Val. I mean, there are so many offerings where, what you're asked to do is just read pages and pages of PDFs. And, this is a million miles away from that. I think, the activities that we'll ask you to do with your colleagues on the program, they'll be very practical, and you should see kind of the benefit immediately of teasing these things out and how would I apply them. So yeah, I think you're absolutely right, Val, and a really, really valuable part of the experience of doing the program. And this is where, yes, assessment is important, but actually the journey is, in the context of medical education, probably more important. And what you'll see in terms of how we assess the program. So I suppose the first thing is, there's no exams. It's all formative assessment, and then generally a reflection on having carried that out. So, for the first module, we'll ask you to plan a teaching session, something short, succinct, but plan a teaching session and record it, and then give get feedback on that, and then reflect on how that went. So you'll be taking the content that you've learned in module 1, applying it in a small, safe environment, and then getting feedback on that. And then the piece that counts for grades is actually you're reflecting on it. Similarly, for module 2, it's let's create a set of learning outcomes for a teaching strategy, and then let's submit that, go through it, and again get feedback on it from your peers, from your tutors, and then reflect on that and how it's brought on your own capability as a teacher. I really like the assessment on module 3. It's look at something in your clinical environment and evaluate how it's assessed, and then make recommendations of how you would enhance it. And that's incredibly practical and incredibly relevant to the environment that you're in right now. And I think what's really important here, and this is where the interprofessional piece comes in and the international piece, it doesn't matter what profession you have, what role you have, or what environment you're in. All of this assessment is personalized and tailored to where you are and what you're doing. And then, so that's the certificate. The diploma then, the first thing we'll do on the diploma is, you will put the content that you have developed in semester 1, you'll put it onto an online learning environment. So it'll probably be Canvas that we'll put it onto. And, you'll give a short presentation of that, and again, reflect on it. Management and leadership, will ask you to do a presentation. So, you're looking at change and development, and then give a presentation on that, and again, reflect on it. And then evidence and values is, I think this one is fascinating. So during the module, you'll have come up with a research question, and then we'll do a review of that. And the output of that is going to be a written submission of that. So for anyone that's moving on to the masters, then you've done an awful lot of the groundwork here in terms of preparation for it. The masters itself, I think I've spoken about already. It's it's a 4,000 word journal article, and it's a conference poster presentation. So very, very applied. Val, is there anything I've missed out on in terms of the assessment?
No, I think that's perfect. I think there's impatience too to find out about fees and timings and the practicalities.
Right. Yeah, and it's funny. I can't see the chat when I've got I can't see the chat window when I've got the presentation open. So I'll fly along to that. Right. What does it mean in terms then, if you're looking at taking on the program, what does it mean for you personally? As Val said, you'll be in a group of 20. And we very much have a capacity limit on this program. It is about 2/3 full at the moment. We will have 4 groups of 20, which for a medical education masters is a large group. We won't be exceeding that. So it's really important to us that we keep the ratios of tutors, of supervisors, and of support staff aligned. So you'll be in a small group of 20, and then you'll be subdivided into groups of 4 for those weekly activities. So it will be a very intimate experience. You'll get to know your group extraordinarily well, and you'll get to know your tutors extraordinarily well. The modules during the certificate and the diploma, that kind of 6-week module followed by a couple of weeks for your assessments, it's a lovely pace. You should absolutely, as Val said, you should be able to turn to this program when you get in, tired in the evening, and be able to study this alongside your other commitments. It's very manageable within your clinical workload and balancing, family life and everything else that's so important. And I think what we can't overemphasize is the amount of support that you'll get will be huge. So each one of those groups of 20, there will be a program coordinator that'll be looking after you. They will get to know you extremely well. You will meet your tutor every week at the tutorials. You'll meet people from the program management team every week at the tutorials as well. So really, really huge level of support and guidance there for you. We have a suite of programs with Warwick, with the Royal College of Physicians, and the statistics speak for themselves. We, in the past couple of years, we've put 1,200 people from 52 countries through our postgraduate programs, not our CPD or residency programs. The engagement statistics of about 88%, that tells us that, people miss things all the time, and that's fair enough. Everyone is going to be a busy clinician on the program, or an educator, or both. But there's hugely positive feedback on program organization and support, and the pass rates that we get are really, really high. Everybody coming onto the program will be an educator or a clinician or both. They will have a really strong learning experience that is really well supported. We expect the vast majority of people to come out the far side. So getting to the nuts of it, entry criteria. So evidence of proficiency in the English language, and this is going to be one of interest to colleagues in the Middle East. So that is not an IELTS test or a Cambridge language test. What we do is, as part of the application process, we get you to give us a 500-word personal statement. You will also be speaking to one of the program advisors about the program, and they will be able to judge on the basis of those two things if your standard of English is sufficient. The only reason that universities in the UK ask for the IELTS test is if you were going to actually study on campus in the UK, the IELTS test is a prerequisite for the visa that you would need. As an online program, that doesn't count. So we don't put that barrier there in front of anybody. So once you are comfortable and confident in your written and oral English, then you don't need to provide us with an assessment of that. What is vital is that you have an opportunity to teach, to mentor, or to supervise throughout the program. We've looked at the assessment in a bit of detail, and you can probably tell it would be very hard to do that assessment or to do those weekly activities if you didn't have the opportunity to implement them during the program. And then what the university do insist on is that you have a bachelor degree relevant to the delivery of clinical education. So that can be medicine, nursing, it can be physiotherapy, it can be dietetics. There's a huge range that is relevant to medical education. So in terms of what we'll actually look for your application, copy of your degree transcript, that personal statement, an employer or an academic reference, either is absolutely fine, just to say that you're an academic or a clinical professional in good standing, and then photo identification. So, and as I said, this is filling up extremely quickly. So if I go on to the fees then. So the fees for the program, and again, we've designed this so that you're getting a qualification from a top 10 UK university at a price that is hopefully accessible and affordable to most people. So I'll go through this. It's in euro and sterling. If you're in the UK, you'll be billed and pay in sterling. If you're anywhere else in the world, it will be a euro amount. So the certificate is €3,750. The postgraduate diploma, which includes the certificate because it's semester 1 and semester 2, That's €7,500. There is an early registration discount of €500 up until the end of this month. So that brings the cost down to €7,000 or £6.50. If you then go on to the MSc, the fee for the MSc is €4,500. There's no other fees associated with the program. You don't need any other materials. There's no there's no registration fee other than this. There's no repeat fees or anything. These are the only fees you will pay. If you want to secure a place on the program, and as I said, it's about 2/3 full, the way to do that is apply, but more importantly, there's a deposit to pay that effectively books your slot on the program. So you pay €1,000 deposit that comes out of this sum up here. So that deposit to secure your place is vital. The team here will put links into the chat, and we'll show you it at the end. So that is the eligibility. And I think the big piece on the eligibility is it's open to a broad range of professions, and you do not need an English language test. We will assess that through the application process. And you give us your degree, transcript, your personal statement, an employer or an academic reference letter, and photo ID. And then on the fees, that the €1,000 fee is what secures your place in the program. And then depending on whether you're studying for the cert, the diploma, or the master's, the fees are laid out here. So I'm going to summarize and then stop. So the program is a 6-month postgraduate certificate, a 12-month postgraduate diploma, or a 22-month master's program in medical education for healthcare professionals. We're just about a month away from the launch of the induction week. So, it is filling up fast. Warwick, it's a top 10 UK university that has a really strong global reputation. The recognition of that qualification is going to be very, very strong. The Warwick on-campus programs are recognised by the Higher Education Authority, by the Academy of Medical Educators. This particular program is going through those accreditations now. It will have extraordinarily strong credentials beside it and on your CV. I think, to a lot of the points that Val made, it's going to be a fun experience. It's going to be you and a group of 19 other people in your group, all learning from each other, facilitated by your tutor, looking at what does the evidence say and how can I apply it to become a better educator. So, it will challenge you, it will support you, it will give you a very safe space to develop your confidence and skill as an educator. So, and it's going to be run by a very approachable, nice, fun bunch of people from all across the world. Val.
Yeah, thank you. I mean, and I could say IHEED is a nice, fun bunch of people. Otherwise, they wouldn't have managed to persuade me. So, but there's a lot of concern on the chat about time. And as somebody who did my master's when I was clinical and doing an academic job, this has been designed to try and make it easy to do when you're as a part-time thing. The tutorials are important. I think it would be an awful shame if you sign up if you can't make the tutorials, because that'll be the interaction and the learning and the fun. And I think Rebecca's already put it on the chat, but that's crucial. If I was doing it, the online learning, I would do a bit like I'm learning Spanish at the moment. I would, at the end of the day, just go up and do 20 minutes. It's all blocked. So you can just do 20 minutes, do a few quizzes, have a bit of fun, and then park it and then do it at another time. I think you will need some time in the week to go on to perhaps arrange to meet your buddies, but that can be mutually negotiated to be an evening or a weekend. And I guess the reading, if I was doing it, I'd be catching up at the weekend, but I don't think you'd have to do all the theory in 1 week. If you had a difficult week, you could catch up the next week. It's there all the time for you to go and look at it. And some things will grab you as really interesting and some as less interesting. And I think you will read accordingly. It is an adult course based on your own learning needs. But the tutorials and just engaging with discussion are the key things. The rest is quite flexible, Dermot. Is that fair?
Yeah,
I'd be doing 20 minutes here and there, I think.
I was going to say, I think, it's designed such that everybody is a full-time clinician or educator and a part-time participant on this program, and that's there as a base expectation from the outset. So we know we're dealing with busy professionals on the program, and that you'll have many things competing for your time. There are multiple ways of doing this. People can chip away doing 10-20 minute slots, absolutely. Other people will say, I'm going to block off a Tuesday evening and a Sunday morning, or whatever it might be that suits your schedule. And I think it's deciding early on, what works for you, and then almost kind of setting that expectation with your family and colleagues as best that you can, so that it shouldn't ever feel like this is kind of taking over every part of your life. It should be really enjoyable. It certainly, Warwick's expectation from their other programs and on this one is, people should be able to manage this with a family and a clinical workload. The average age on the programs that we run is it's either 42 to 44, depending on the program and the year. And that says to me that, and I should say, about 60% of our intake tends to be female. So that says to me we've got an audience that are full-time clinicians. Lots of people have young families, so we're dealing with a very busy population, and we've designed the program and supports around the program that people feel supported as they go through it. I think Rebecca made a good point there on the attendance of the tutorials, and I think it backs up what you said, Val, that this is adult learning. Attendance is captured so that we can see if people are really struggling, but and the tutorials are all recorded, so they are available for you to watch back afterwards. I do think, though, you miss a very important part of the growth of your group and of yourself within the tutorials if you're not attending them live. I think it is, it's fine to miss them occasionally, everybody will, but I think there's such a value in coming together with your colleagues. I think they're hugely important. Right, what else have I missed on chat, Rebecca?
The chat has just been on fire. So what have you not missed, dear?
Great. I'm sorry, I've been blissfully unaware.
It's been crazy, which is wonderful because it shows real enthusiasm. What I might just do, guys, before we open to more Q&As, run our final poll, if you don't mind.
Brilliant, and I'll read through some questions while you're doing that.
And Dermot, is it okay if I bow out now?
Of course it is, Val.
If that's all right. Unless there's anything absolutely immediate. I think I've
No, thank you so much.
No, conscious use of other things. Thank you so much,
lovely to meet you all, and so hope to see you on the course.
Thanks, Val, you're great.
Thank you.
Have a good evening. Bye.
So let me see.
So just on the poll, guys, it's just so important to understand your motivation for participating tonight. And if you're interested in the next forthcoming intake in a few weeks, or you would like to, express interest in another intake in the future, and what's the best way to contact you. It's just really, really important that we understand who you are so we can best follow up after the event.
Yeah.
So the more that response we get to this particular poll, the better we'll be able to serve you after the webinar.
Yeah, so just reading through some of the questions here, Rebecca, on the tutorials. So I think, first of all, there will be multiple tutorials. So, there'll be 4 groups, so there'll be 4 tutorials every week. If somebody can't make a particular tutorial, they can sit in with one of the others. But we will, we will group you according to a time slot that we think is going to work best for you. And then we will constantly talk with your group throughout the year to make sure that that is working. So, I think the tutorials, they should be accessible. I mean, we've about 300 people on our masters in diabetes with Warwick, and there's a huge amount of those from across the Middle East. And that is, I'd say probably in some ways it's a different challenge, but there's more reading involved in that program for sure. And the tutorials are just as essential. The statistics for last week's tutorial was an 87% attendance rate. So, people are coming to the tutorials all the time. Okay, other question, interesting. The research should be done individually or by group. So when you're on the masters, you'll do an individual professional project. So you'll do an individual research piece on the masters. Why do we need to submit or get a reference letter in the application? Warwick, so the program is for healthcare professionals. So Warwick need to assure themselves that people coming onto the program are either academics or clinicians in good standing. So is it recognized by the Ministry of Education in the UK? Yeah, absolutely. It's a UK university. It's a UK masters like any other UK masters. Okay, what else? If you've already completed a PG in medical education, can you join and complete the masters? So probably not is the answer. It's if you have a certificate from another UK university or even from Warwick, it's unlikely they're going to let you straight in to do the master's piece. This program has been designed to follow a very particular journey, so they're unlikely to do that. The tutorials they're between 60 and 90 minutes long, are the tutorials, and Friday mornings are looking like they're going to be the most popular time. For people in the UK, that'll be before work. For people in the Middle East, that'll either be before or after prayer time. And then it'll sink in very well with people in Asia as well, because it'll be their evening time. So yeah, Charmaine is asking, is it recognized in any European country? It's a UK master's degree or postgraduate certificate or diploma. So yeah, it's sitting on the UK National Education Framework, which gives it global recognition. So let me see, what else have I? You're right about the chat, Rebecca. It's brilliant. Okay, when will the program be commencing and when will we graduate? So commencing on the 20th of June. The graduation then will obviously depend on when you exit. So if you do the postgraduate certificate, you would finish up approximately 7 months after that. If you do the diploma, approximately 12 months after that. And if you do the master's, then you'll be in and out of the master's within kind of 22 months. So very, very much depends on which qualification that you go for. And I think somebody else asked, could they do the diploma and then come back and do the master's? And yeah, absolutely, you can do that. Once you start, you have 5 years to finish basically with your qualification. So the entry criteria, can I explain the entry criteria a bit more? I can indeed, and I will. I'll bring it up on screen again, actually. So
end the poll. Thank you so much, everyone.
Yeah. So the entry criteria. Our colleagues, James, Nullig, etc., will be talking to every single person that's coming on the program, and they will make a judgment along with the personal statement that you have an appropriate standard of English. And it's a standard of English that is good enough that you'll be able to converse with your colleagues in the group and complete the evidence-based reflections at the end of the assessments. So that's the first piece. Probably the more important piece is that you're able to that you're actually able to teach throughout the program, that you've got an opportunity to put what you're learning into practice. That can be one-to-one mentoring, that can be small group supervision, that can be bedside teaching, right up to that can be you in a lecture hall with a group of students. So there's a huge breadth of possibility as to what that looks like, but it is really important for the assessment that you're able to practically apply what you're learning. Then the kind of the functional bits of, you have to have a bachelor degree in whatever profession you are in. You have your degree. So then you give us that transcript of your degree, your personal statement, and the employer reference and photo ID. So that is, the entry criteria they're designed to be pretty broad, that we want a strong mix of professions on the program. And, as we're seeing on the talk tonight, we'll have a strong mix of countries as well. So where else are we in questions, Rebecca?
Yeah, there's so many coming through. I know there was
one. Is there an age limit? That's a great one. No, there's not an age limit. We have an 87-year-old on one of our programs, albeit it's our pediatrics program, ironically, that we have an 87-year-old on, and they are flying. So no, and we regularly have people that are retired doing both the diabetes and the pediatrics program.
So Shafin, we've worked with SEHA in the UAE for many years, and we have CME recognition for this program.
Yeah, and our colleague Anthony, who's on the call, has a very close relationship with SEHA. Our Middle East office is in Dubai, so we have a very close partnership with them.
The next intake will be November.
Yeah. Can I run over the pricing? Yes, I absolutely can. Let me bring this back up again.
Yeah, it's a good question because it can be very, very confusing. So apologies, everyone. I know it can be.
It can. So pricing, the post, and you know what? I'm just going to talk about the euro pricing just to keep it simple. The same principle applies if you're in the UK for sterling. So the postgraduate certificate, which is semester 1, that is €3,750. The postgraduate diploma, which is semester 1 and semester 2, is €7,500. But if you apply before the end of this month, there's a €500 reduction, which brings that cost down to €7,000 for the postgraduate diploma, including the certificate. If you then go on to do the MSc is €4,500. So the total cost of the MSc, if you apply before the end of the month, would be €11,500. The total cost of the PG diploma would be €7,000, or the total cost of the cert would be €3,750. So they're the three prices that you are looking at. The deposit is this is binary. If you have paid your deposit, the space is yours, and you then get your application details in and your documents in as you want. If you haven't paid your deposit, the spot is not secured. And as I said, I think it's just over 2/3 full at the moment. So we fully expect that this is going to be oversubscribed, which is fantastic. But I think what it means is, if you are interested, please do apply and pay that deposit as soon as you can.
The deposit deadline for the early registration is the 31st of May. So that is imminent, just to let you know.
That is about as imminent as you get, all right.
So after that, the early registration discount will not be available, and you have to pay full price.
Yeah. When you are then paying, you can either pay by semester or you can pay by month. So if you're doing the diploma, it will be 10 payments spread across 10 months. Obviously, if you're doing the cert, it's 5 payments across 5 months. So you can pay by semester in 2 payments and then pay the MSc, or you can pay monthly. So and as I say, these fees they're designed to be hopefully accessible to most people, and certainly for a top 10 UK university qualification, we're very confident it represents excellent value, especially the prestige of the qualification, and just the amount of support that you will get throughout the program is huge. Right, I can see another 20 chat messages since I've had that screen open. What else has come in on chat?
Huda, if you don't get a certificate for every single piece of.
No, that's a good question.
Yeah, so if you progress in from the PGDIP onto the MSc, you get your final capstone certification.
Yeah, so whatever the highest award is when you exit, that's the certification that you get. Mansoor, there's 80 places available, which is 4 groups of 20. So, you know, that's the cap that we're putting on it. And we won't be going above that. Sorry, what's that one? The research is individual or group. So the research is individual. So the actual, I suppose the calendar, actually, that would be just that question has come in on timing. If you bear with me 1 second, I will open up the timetable and share it here. So bear with me 1 second. I'll make this huge so that everyone can see it. Right, I will go through the timetable for a second and share screen. So the timetable. So for semester 1, for people doing the PG certificate, the induction week starts on the 20th of June. So then the first week with your first week tutorial starts on the 25th of June. We go down through the 6 weeks. We then have a reading week, and then your assessment is due at the end of that second reading week on the 21st of August. There's then a week off, and we come back for semester 2, or sorry, for module 2 on effective teaching. The same rhythm applies here all the time, and it works well that you can predict your commitment to the program and kind of plan around it. So you know the 6 weeks that you have, you know the reading weeks that you have, you know the weeks off that you have. So the certificate will finish, effectively it'll finish on the 17th. Well, the last class you'll have will be the 3rd of December, and then the next class you'll have will be the 7th of January. So there's quite a gap around the Christmas and New Year break. Similarly then, so semester 2 starts on the 7th of January. And again, you've got your 6 weeks of classes followed by your reading weeks, and then your assessment is due. We then pair off in 2, and we have a spring timetable and a summer timetable for modules 5 and module 6. And our rationale here is people that are involved in academia in the UK, for example, may well prefer to do these modules when it's not conflicting with their end of year exams. Similarly, anyone who is observing Ramadan and Eid will be grateful for the time off here and not clashing over March and April with Ramadan and Eid. So you choose effectively which timetable you want to go into then for 5 and 6. So they will run either that you'll finish in July, or you finish in September, depending on if you want to take that break in the middle around Ramadan or around the end of the traditional academic year in the UK. So that's what the timetable looks like. It's, you know, the reading weeks and the weeks off in between, you know, they break up the modules very nicely. And we've had this structure on other programs for years now, and it works very well to kind of balance your family commitments and your clinical commitments. So that's effectively what the timetable looks like. Where are we? Will applicants for masters get preference over PG cert or diploma applicants? It will be first come, first served. So the first 80 people onto the program will be that are eligible will be accepted onto the program, and we will let that question Sanaya has just asked. How can I know if you accept me? We will assess your application really quickly. We will generally get back to you within 24 hours to let you know. So so is a semester yeah, so the first semester is the certificate, the second semester is the diploma, the third semester then is the master's. The master's, actually, Abdul Latif, very good question. The master's is an MSc in medical education. It's not an MEd. I'm not quite sure the rationale in Warwick as to why it's one or the other. It makes virtually no difference as far as they're concerned, but it's an MSc in medical education for healthcare professionals. That's the
exact title is for healthcare professionals at the end. So MSc in medical education for healthcare professionals will be what is written on your certificate.
Yeah, I think what's crucial there, Rebecca, is what won't be on the certificate is anything about online education, distance education, it is the exact same as any other University of Warwick certificate. So the third module timetable, I actually don't have that to hand, Simi, but I can send it on. We can send it on after this. Effectively, the MSc portion will start at the end of September 2022 and go on from 10 months from there. Is the MSc equivalent to any other master's program globally? Yes, it absolutely is. It is a level 7 UK qualification on the QAA education framework in the UK. So it is a UK master's program, equivalent to any, in Ireland, various master's programs have either 3 or 4 semesters. It's not actually down to semesters, it's down to the credits that the program accumulates. So there's 620 CAT is what they're called in the UK, 620 CAT modules, followed by a 60 CAT module for the masters. And that is equivalent to master's programs all over the world. We will email on the presentation, Zoom user has asked. So yeah, we'll send on the presentation afterwards with a copy of the recording as well. Okay, so what else is on chat? Lots about if I don't get accepted, when is it on next?
I think that's more or less it. We don't offer PhDs, Rekka. So I think we've gone over time, everyone. So I just think it's been a wonderful session. And thank you so much for participating. Just to let you know, as I said, we are recording this session and it will be sent to you by email and you will receive it in your inbox tomorrow. If you don't see it in your inbox, please do check your spam, but it shouldn't go into your spam, but just be on the safe side. And then after that, our education advisors will be reaching out to you in person, usually using a UK number. So please keep an eye on your phone. If you can't answer the phone, they will also reach out to you by SMS or WhatsApp to see if you want to secure your position for this forthcoming intake. As Dermot said, places are limited. So if you do wish to secure one, we would advise that you proceed to application and to deposit payment as soon as possible. Yeah. And within that email where you get the recording, you will also get a link to the application form and a link to the pay deposit. So but let you, just to reassure you that our education advisors will be contacting you if you do have any additional questions.
Yeah, so look, thank you so much for your time this evening. It's been a really great session. The amount of questions is fabulous. I've just looked, there's deposits have been paid in the last 10 minutes, which is a brilliant sign. So look, well done everyone. Thank you so much for coming along. It's going to be a fantastic program and hope to meet lots of you on it.
Thank you so much. We hope to see you soon. Take care. Bye.